Regarding prescription drug prevention, what I would say to parents really encompasses 4 different things. The first would be to be a real partner in your child's health care. Don't be afraid to ask questions of your child's doctor. Don't be afraid to question their prescribing of prescription painkillers. For instance, if your child is having dental surgery and they are prescribed 30 Vicodins, ask a question about that. How long should they reasonably take those before they should be seen again? And certainly I would question any refills or anything like that. The second thing would be to have frank conversations with your child about prescription drugs. Sometimes we assume that kids know what we think, and we assume that our child knows better than to accept a pill or other prescription medication from a friend or relative, but that's not always the case. So I think having a conversation with your child, letting them know what your expectations are about don't accept a medication that wasn't prescribed to you. Don't take anything and don't offer anything to someone else that wasn't prescribed for them is a really important component as well. The third thing would be to monitor their use. Monitor if they've had an injury and they're taking some kind of prescription. Make sure that they're doing that appropriately. Make sure that they're doing that according to the doctor's prescription, and make sure that you feel comfortable enough that if you think that they've been taking it long enough, I would really have a conversation with them, have a conversation with the doctor as well. And the last thing that I would recommend to parents is to model good behavior yourself. Be aware of your practices as far as taking prescription drugs, and don't give unintentional messages to our kids.